Good afternoon. I'm Mayor Jim Langfelder in Springfield, Illinois. I'd like to welcome you to our Facebook Live. We appreciate you joining us in our efforts to further engage the public and educate them on what's happening, not only with the coronavirus pandemic, but also in our community. And today we have a great panel. We have Dr. Vidya Sundareshan from SIU Medicine, Director Gail O'Neill from Sangamon County Public Health, and Fire Chief Alan Reyne with the Springfield Fire Department. And I'll introduce them in a few minutes. But first, just to go over a couple items. Last night we did have City Council meeting with regards to one of the items that was passed was our mask ordinance. We had one in place where pertained to individuals that are out in the general public at retail establishments where they'd have to wear their proper wearing of the face mask, with regards to over your nose, mouth. We actually had a card developed that clerks could pass out to individuals within the stores, and it kind of it de-escalates a situation, because what could happen with an individual if they're not wearing it properly, they could be cited for a $50 fine. So, a clerk, if they ask you to put on your face covering, or any individual, it's for two reasons. One, it's for your own health and the health of others. And the other item is it's so you don't get a $50 fine if police or, the fire department can issue a citation, as well as public works inspectors. But we broadened that ordinance last night. We did approve it where now it pertains to all public indoor spaces. So if a business or a company is open to the public, whether it be a bank, insurance company, mechanic, any of those areas, they are under the same guidelines as retail establishments. So they should have signage up directing everybody to wear their masks when they come in. And then everybody in that vicinity, if they're, close to others, they're expected to wear their mask properly. And if not, they could receive a citation if one of our, like I said, personnel from the city come in and see that they're not, then they could fine not only the individual the $50, but also the establishment. And the whole purpose of this is to try to mitigate or to reduce the coronavirus positivity rate in the city of Springfield, but also with regards to taking the stress off our hospital system. It's just not, it's across the country now, it's across the the state of Illinois, but all our communities, we've seen an escalation of hospitalizations. And, so it's put an undue stress, not only the facilities, but most importantly, the nurses, the doctors, and individuals that are caring for us. And we'd like to be as proactive as we can. And what each person can do is take that extra step to not only protect yourself, but protect others by wearing your mask and stop the spread of the coronavirus as much as possible. So the other thing, the governor did come out with his tier 3 mitigations, announced those yesterday. And the main impact is with the additional encouragement of it's not quite the stay-at-home order, and it's kind of a precursor. We do not want a stay-at-home order. We want to make sure that we can keep businesses opened up as much as possible. And we want to reduce the infection rate, the spread rate, just what I just covered. But in order to do so, especially with the holiday season of Thanksgiving coming up, is that do not have large gatherings outside the home. If you're spending Thanksgiving, do so with your close loved ones, because the exponential spread is due to individuals letting their guards down, whether you're hanging out with friends or if you're coming in contact with coworkers and you might not have your mask on properly, or you've kind of, gotten within a close distance. And that's one of those forewarnings is the best way to prevent the spread, again, is to make sure, I think Dr. Sundareshan came up with this, or somebody did, the 3 W's. Watch your distance, 6 feet from an individual, wear your mask, and then wash your hands as frequently as possible. So those are important guidelines. And if we do that, we'll make it through these next several months. And I'll add one more caveat: be sure to get your flu shot, because that's an added level of protection. And for the first time in my life, I got the flu shot, because you don't know how that's going to mix with the virus. So I just didn't want to go down that uncharted path of the coronavirus with the flu. You just don't know where it's getting us. And that's always a cause for concern. So the more precautionary measures we can do, the better. So those are the highlights. The other thing we did roll out for the restaurants and bars and small businesses, we have a business grant that will award up to $5,000. And you can go to our website. It's springfield.il.us/grants. And so if you're a small business, we encourage you to fill out the application, and it's try to help you through these challenging times ahead of us, so we can get through these next couple months and, kind of offset the costs that you're incurring due to the virus. So those are some of the items that we have. If you want to ask questions, you can do so through the Facebook Live feed, or you can go to feedback@springfield.il.us and send it that way, any questions that you may have. So we appreciate you joining us. And since I was going with, I guess I'll introduce the guest first, and then we'll have Chief Reyne go last, and he can give an update on what's happening within the fire department. But first, I'd like to introduce returning guest, Dr. Sundareshan with SIU Medicine. And this has been a very eventful 50th anniversary year for SIU Medicine, but especially during the pandemic of 2020, who would have thought we'd be in this? But we're very blessed, very fortunate to have someone at her expertise, not only helping SIU, not only helping our medical community, but also Sangamon County Public Health, and helping usher us through or navigate us through this challenging time we're all facing. So, Doctor, if you'd reintroduce yourself to everybody, we'd appreciate it, and share anything you'd like about the current state that we're in.
Thank you, Mayor, for that very kind introduction, and thank you for having me again. I want to give credit about the 3 W's to Dr. Ezike, who was the first I heard that from, but it's widely used. In fact, there's even a hashtag now for 3 W's. But yes, we would add one more V, which is the flu vaccine. Thank you for getting your flu shot. I got mine, and most of our colleagues here have gotten theirs through their workplace or their primary care physician's office. It's important to make sure that we are protected against flu as well, because we are also seeing flu that has now started to surface in our Springfield area as well. So with that, I want to quote Dr. Ezike again. She says that we're working, living, playing differently this year, and we're going to be celebrating holidays in a different way as well. With the numbers of COVID that are up nationally, we're really high in those numbers, and in the county we're kind of mimicking the same curve. In fact, what is different about our county is that the rate of acceleration is much higher. In the last 10 days or so, our curve since the 30th of October is almost vertical, which is concerning. So we can definitely do better as a community. We have to work together as a community to try to get that down. We were expecting a second surge, or even a third surge for COVID. That has always been a concern, particularly for the winter months. And that's exactly what we are seeing. In fact, what we experienced in April was not even a surge. It was very small. As compared to that, our curve is really large, and the acceleration or the growth or the trajectory is really almost vertical, which we need to do something about. So as Mayor mentioned, With the numbers that you see in the community for people that are diagnosed with COVID, the hospital numbers pretty much mimic that curve. So, or they mirror that. So if you see high numbers in the community, you're going to see high numbers in the hospital as well. That constitutes as a cause for a lot of strain on the healthcare workers. There are people that are out quarantined, or there's not enough staff taking care of these patients who really need special care when they're admitted to the hospitals. About 20% or so can get extremely sick and be admitted to the ICU, which is even further specialized care. They can get other infections, bacterial infections, and even with people who may be managed at home, post-COVID syndrome has been reported. So people can have a lot of complications, about 1/3 to even higher numbers, to 1/3 to 1/2 can have some kind of post-COVID syndromes. So we worry about that as well. With holidays coming, we have safety guidelines from IDPH, Illinois Department of Public Health. Be very cognizant of the numbers in which you celebrate. Try to be with your families as much as possible. Location, outdoor is better than indoor. The timing of contact, if you have other families invited, you want to minimize the timing. And then also be very mindful of before the holidays and during the holidays, be as safe as possible. Masks are of utmost importance. You wear it for yourself and also to protect your loved ones. It's very, very important. We need to do this together. And I'll end with one good news, that is vaccine for COVID is now showing excellent efficacy or effectiveness. Two companies, Pfizer as well as Moderna, both their vaccines are about 90% or greater than 90%, 95% effective from the information that we have so far. And we will most likely have those vaccines available by the end of this year or early next year. So that's good news in terms of what we have. So thank you, Mayor, and I'll hand it back to you then.
Well, thank you for that. And real quick since you're probably the best expert on this panel with regards to the vaccine, if you could just shed your knowledge on what it takes to get to the point it's at, because a lot of people might feel nervous when the time comes, but there is a rigorous testing process in order to reach that 90% success rate before they even reach that level, because it's my understanding that the first ones correct, rightfully so, would be the first responders, the medical professionals that would receive the vaccine, because that way you can treat more people, and as well as the ones that might be highest risk. But if you could speak to that testing process, that really gives a little more reassurance to everybody that it has been tested and validated, and that's why they're seeing this success rate.
Absolutely. So vaccine science in itself is pretty complicated, and we have come a long way in vaccine sciences. There are different types of vaccines that we have used for many, many years. And typically vaccine, when a new one comes out, it takes about 4 to 5 years for vaccines to get into the market. But imagine how much of progress science has made. We are using a really small part of the genome of COVID that has been now identified. They identified the entire genetic material of COVID very, very fast. And we're just using a very small part of that, the spike protein, the protein which is on the outside of the coronavirus. We're using just that, along with a protein called mRNA. And when that is given as a vaccine, it's able to produce antibodies which are very effective. The new vaccines definitely have to go through the same safety protocol, but everything has been done in an accelerated way. This mRNA type of vaccine they have been studying for many years, and now they've been able to successfully produce it. And we're seeing that it's extremely safe. We have 11 vaccine contenders in what we call the phase 3 trial, which is where they've started giving it to volunteers and studying to see if there are any adverse effect or serious adverse effects. We have not seen any significant adverse effects, or serious adverse effects have hardly been any. It's just been pretty good. The vaccines can be associated with muscle aches or body aches. Those are some of the things. It just shows that the vaccine's working. You're developing antibodies. So that's a good thing in terms of response. But other than that, we have not really seen any serious adverse effects or even adverse effects.
Well, thank you for that explanation. That's very helpful. And next, I'd like to introduce Director Gail O'Neill with the Sangamon County Public Health. And actually, Gail started with the Springfield City Public Health Department, and then through the merger, became Public Health Director. And she's been at it a long time. And I'm sure she could talk about vaccines too, and different pandemics, not necessarily pandemics, but large-scale vaccinations that they've had to do through time. But we may be heading that direction at the tail end of this. But we really appreciate what you've been able to do. I know, and you're just like the rest of us. Any decision you make, it's met with criticism and critique, which is valued if people do it in a positive manner. We all have the goal of trying to keep people healthy. How do we again, stop the spread of the coronavirus? Every day is different. I thought we'd seen just about everything, but I've been thrown some curveballs this week, and I'm sure we'll cover some of those during this discussion. But Gail, Director O'Neill, we really appreciate all you've done to help keep us healthy here in Sangamon County. So if you'd like to give an introduction of yourself and anything you'd like to add with the current status of the situation, we'd appreciate it.
Yeah, thank you, Mayor. And you're right. I've been around in public health around here for quite some time. I think 34 years and counting. So we've been through a lot, and we've always been very fortunate as a public health community to have the support of the city and the county, and all facets. It's these diseases that we've dealt with over the years aren't a city or county issue. They're a people issue that just happens in our community. So it's been an honor and a pleasure to work with everybody pitching in, and that same thing is occurring now. We make decisions, Vidya, we all do with what we know the best at the time we know it. This is a new disease, and I think we've learned lots of things have changed since March. I mean, the things that we've learned since the beginning of this year, symptoms change, treatments get better. But what we do know is it's still passed from person to person, and it's going to take everybody in our community pitching in together and taking these precautions that seem so simple, but some people feel that, we should be used to it by now. Wearing a mask is different than we've ever been used to before. People don't like it, but it works. And staying apart from one another is real important in our community. So staying apart, wearing the mask, and hand washing are just the basic public health principles. We talked about the vaccine, and we have been informed that we will get vaccine. The state was making sure that all the health departments that will be getting vaccine have the ability to store vaccine at minus 80 degrees. So that's pretty darn cold, and we do have that ability already. If we didn't, we could purchase the refrigerators. I thought the interesting thing we needed to buy this week was gloves. You got to have a way to get the vaccine out of the refrigerator. It's all these little things that kind of play into this. The vaccine is a 2-dose vaccine, which will be a little different than what we've done with a lot of vaccines in the past. As it stands now, the person who gets the first gets their first dose needs to have the same lot number and the same brand of vaccine the second time. So if we have 100 doses to give, we could probably serve 50 people with that. So we provide the vaccine, and then 28 days later, you probably make the appointment right away for the next one. I do think the priority levels will be kind of spelled out for us with healthcare workers and the highest risk people first. I don't know that for sure. We've kind of been through that before, and it does cause a little bit of frustration to the public when there's there's guidelines, but we always get through it together. And we're working together with the plans for mass vaccination when it's here. I know our community partners are all willing to help as well. So we'll see that come together soon, I think. So that's really good. The holidays, I'm sure we'll talk about a little bit, is, there has been some really good guidance. The Illinois Department of Public Health, the website, your website, our website, kind of puts all these links there, but there was some new ones yesterday that, put some really thought into even the traveling, the overnight guests, holiday shopping, how to serve the food. The key this year, I think, and a lot of people are starting to think, Thanksgiving is going to be different this year. It might be best spent with just the people in your household. Because there's so much virus in the community. We certainly don't want to infect our younger children, our older people, our grandparents. It's just a time where the risks are so great that it seems like, okay, we'll just have to have a different Thanksgiving this year. And then after Thanksgiving becomes holiday shopping season. So there's thoughts about that too, of limiting and being careful with those issues. So I appreciate you inviting me. I'd like to, be available to answer any questions and see where we go.
Thank you very much.
You're welcome.
The one thing, if you could touch on briefly, is there's you have testing all over the place. You have Walgreens doing it, SIU's helped, and public health as well. If you could explain that process and how that's all sent to Illinois Department of Public Health, I think that'd be useful information.
Oh, sure. And there is quite a bit of testing in our community. We're fortunate. The SIU is running one of the clinics over at Abundant Faith Church. They serve, and this is kind of what you have to look for. They serve, are there differences? They will treat and test anyone, regardless of age or if people have symptoms or not. It's open to anyone. The Memorial Center's Respiratory Center treats and tests symptomatic people on South 6th Street, and you call for an appointment. I mean, there's so much more now that even with testing, some things change from day to day. Walgreens, you used to be able just to drive up, get in line and get it. It's so busy that people need appointments now for that. Occasionally, if it's slow, I think you can get in, but they will test people 19 or 18 and older. Some of the CVS pharmacies are doing an appointment drive up and a self-administered test as well. There's quite a bit of testing here. I know Springfield Clinic will do it. At most doctors' facilities have the way to send you for a test. The challenges are waiting to get the results. There are more rapid tests now, but overall the tests may take a couple days. And from the time the person gets a test and finds out they're positive, from the public health end at the local health department, it takes us a couple more days to find out that they've, you can get your results, but it needs to be loaded into the computer system from the state for us to know that somebody new with a disease is in there. So sometimes there's a delay with that. So we're dependent on some good reporting from all the facilities that do the testing.
And then once that's gathered, is it all sent to Illinois Department of Public Health? And then they accumulate the information and send it back down, I guess. Is that how that operates as far as that part?
Yes, the places, report it to the Illinois Department of Public Health, and then we go back into that computer system every day and pull out the ones for Sangamon County. They instituted another computer program for, knowing who's infected and managing contacts called Salesforce. And so between those two programs, which is INEDS and Salesforce, is how we learn about the cases and how we manage those. And the state put that in place in July. So it was kind of new for us to learn, but things are working pretty well with that program.
Well, thank you. And I appreciate you being here. And someone that knows all about testing recently is our Springfield Fire Chief, Alan Reyne. They went through an incident where they just started with a few individuals and how fast it escalates. And then when you have to quarantine individuals, that really creates a challenge for any workplace. And one thing I can say about Springfield, the government, I think we had our first case either in May or June. So we went several months without even having a case because of our protocol measures. But Chief reminded us, as far as the fire department goes, it wasn't until September. So we were one of the last fire departments to incur a case, but then once it happens, they're in close quarters working with one another, and it just goes that direction. But the other news he broke last night, of course, is with his pending departure, which we're starting to see because he's been a great advocate for helping out with the incident command group with the county, being our point person from the city and coordination. So, Chief, we appreciate you taking time, and if you'd like to give us an update on the fire department and anything else you'd like to share, and then we'll go from there.
Yeah, I can talk personally about my story, and I'm the first to admit that I did exactly what Gail O'Neill has been telling me not to do since May. And I've had the fortune of sitting next to Dr. Sundareshan, and she has said since May, don't let your guard down. And that's exactly what I did. I got too comfortable with an old friend. I always say, everybody's got their sayings. I always say in and out, up and about, that's when you're supposed to wear your mask, in and out of the place, and when you're up and about from your table. And I certainly did that, but I was infected by somebody that was sitting with me at that table. And you just get comfortable. And boy, do I regret that. I had 10 horrible days. I thank God that most of the firefighters that have had it didn't have it the way I did. For me, it was unbearable fatigue. It was what I call 3 bad days, and then about 4 decent days where I felt just okay, kind of blah. And then I had a ton of bricks hit me. And it seemed like that last 24 hours until my fever finally broke was horrific. And I wouldn't wish that on anybody. So that being said, I am well aware of the fact that there are a lot of people that don't get to tell their story. So I'm not asking for any sympathy. I am well aware of the fact that, I messed up, and I let my guard down. I wished I hadn't. And I certainly didn't want to bring that on the city and the county, which we've been working so very closely to try to mitigate this. But, I'm happy to tell my story, hoping that anybody that hears it will not make the same mistake I did. So I've been back to work since Monday. I feel pretty good, and a little bit of energy, not quite there. If I walk up a flight of steps, I still have to stop at the top of it. And that's, but I'll get there and getting back to normal. And of course, like everybody else, I worry about the long-term effects, the stuff that we don't know, and certainly hope that I haven't caught something that, 5 years down the road is gonna bite me again. But Gail hit it earlier on the head, and something that I say a lot is, all decisions are made better with the benefit of hindsight, and we don't have that. And I watch everybody at every level of government on both sides of the political aisle get beat up over decisions that they've made concerning COVID. And I have a great deal of sympathy, because it's very easy to question those decisions when you know the outcome. It's very easy to question those decisions when, quite honestly, your opinion doesn't really matter as much, because if the people that are guiding this, that are steering this ship, if they're wrong, more people are going to die. And that's the bottom line. And I have a great deal of respect for them and the guidance that they've provided me personally. Believe it or not, a firefighter coming up through the ranks, we don't learn a whole lot about how a virus spreads other than how we can keep from getting it. So we have to rely on those experts. And we've certainly had a lot of good information that has been thrust upon us, both at the federal, the state, and then more importantly, the county level, because everything is local. And, I do agree that Springfield is different from Chicago, and rural Illinois is different from Springfield. I've never been a broad brush guy. I think that, breaking our state up into regions and the way we have was probably the right approach. But our state's on fire right now from top to bottom. It doesn't matter where you're at in the state, you are in a hotbed. And that is what, you can trace it from looking at the numbers. It seems like you can really go right back to Halloween and those events. And that's what really worries me about Thanksgiving. And, my family is small. I don't come from a family like the Langfelders. I come from a small family. And but you know what? We've decided to just put it off this year. We're going to hope to get together for Christmas. Hope that maybe maybe the vaccines have started by then, or that something's changed and that it's more safe. But I'll be honest, we haven't even really, we've even talked about just putting that off until later, because again, the most dangerous person in my mind, and Dr. Sundareshan and Gail may disagree, the most dangerous person is the one who doesn't know they have it, that are walking amongst us. And those are the ones, and it doesn't matter if they're 5 or 95, those are the ones that we want to make sure are identified and not spreading it. And I felt very lucky in the fact that me personally, I just happened to have kind of a down weekend leading into when my symptoms started, but I separated myself immediately from my family, and that, my wife and son and daughter never got it. And trust me, we don't have a lot of space. We don't have a lot of room to separate in our house, but we were able to do it. And because we identified when I came upstairs, if I came upstairs, I had a mask on, they had a mask on, and we identified just those areas. Then unless I was sleeping or sitting by myself in the basement, we took those additional steps. And it's not comfortable and it's not fun. And I didn't enjoy those 2 weeks, but I certainly didn't want to give this virus to somebody that I cared about. And more importantly, I didn't want them to spread it to other people. So as far as, the only thing that really replaces science is better science. And we continue to learn, we continue to listen to the experts, and we continue to heed their advice as we try to manage this pandemic at a local level, hoping that spreads to the region and to the state.
Well, thanks, Chief. We appreciate it. And thanks for sharing your own story. I think that's helpful when we personalize it. And I guess for each one of our panelists, Chief kind of touched on it. How would you recommend spending the Thanksgiving, or if you want to share how you're doing it, or, in the same fact as how do we bend the curve in the process? Because it's important. What the pandemic has shown us is the importance of life, the importance of one another, and then how best to manage through it. And, Thanksgiving is the day that we all give thanks and appreciation. For myself, we'll just be with my direct family, with my wife and children, and then my in-laws. But we've been doing that for for quite some time. But when they come in, I've said this, I mask up with the grandparents and as far as our granddaughter too. I've never kissed her directly, just because of that, aspect. And then we eat at separate tables, keep our distance, no hugs or anything of that nature. But that's an important way that we've done it. With my brothers and sisters, we do the Zoom like we're doing here. We used to get, visit each other once a week for chili. It's a great family occasion, or cultural for us. But now we just do it through Zoom, so you can get that FaceTime at least, and show your appreciation for one another in that way, verbally, but also, that physical aspect that you are sensitive to their needs and your own, so you don't infect one another. But that's how we plan on doing it. And I didn't know, Dr. Sundareshan, if you'd like to share what you would like, and then Gail O'Neill and Chief, would you like to add anything else?
Absolutely. This is a beautiful time of the year. And, we celebrate too. We traditionally have met with a big group of friends for Thanksgiving. That's something I've always looked forward to. Despite being on call, that would be something that always gave me a break and a time to be thankful and grateful. It's really a nice time of the year. But this year, we are going to carry the same spirit of being thankful and grateful, but for a lot of things that are a little different. Very thankful and grateful for a community and supportive friends, supportive medical community here, supportive public health community. So there's a lot to be thankful for, support from the city. So we're really, really thankful for a lot of other things. And what we can best do is be safe. That's what we can do to pass that spirit forward. So be safe as much as possible. Celebrate with your immediate household. Like what Mayor, you were mentioning, virtual celebrations are best. being with your immediate household, and then virtually celebrating with the extended family. But if you are having families over, it's best to follow protocols and guidelines which are already available in detail on the Illinois Department of Public Health website and CDC. You want to make sure that prior to these gatherings, 14 days prior to the gathering and at the time of the gathering, you're just watching and being mindful, keeping masks on all the time, except for the time that you're eating or drinking, having a separate area where the masks are stored if you're taking it off for eating and drinking. Watch your distance, try to be 6 feet away, hugging and kissing, try to avoid that. You can wave, you can still have that conversation from the distance. Outdoor events are better, weather permitting. Outdoor events are better as compared to indoor. Limiting the timing of these gatherings. You don't want to have prolonged gatherings. Try to avoid speaking loudly or loud singing. Those are some of the other things that have been identified as risk factors. When you're outside, wear your mask all the time. Food preparation, you want to avoid buffet style or potluck. Preferably one person who can be the designated food handler. You don't want a lot of people handling food. Try to choose the menu wisely so that you don't have to handle food that many times. Just prepare the plate and that's it. So all those things are definitely useful. The seating arrangement, if you're having more than one family get together, pay special attention to how the seating arrangements are done. People from the same household can be seated together, have some space between different families. If there is any travel involved, be really mindful about who might be attending. If there are any older or vulnerable people, you might even consider getting tested before traveling, about 48 to 72 hours before traveling, to make sure you have a negative test. There are many places in the community, like Gail was mentioning, that could get you the test. The turnaround time can be anywhere from 24 to 48 hours, some places 72 hours, but you will still have the results. So that could be another consideration. But be careful about your activities prior to going there. 14 days, just be very careful about wearing a mask all the time. Masks work. We have a lot of data that masks work. They do protect us from acquiring things from others, and if we may be carrying the virus and not know, if we're pre-symptomatic or asymptomatic, it will protect our loved ones too. So masks are definitely, they have to be worn correctly, and they do work.
Yeah, it's all great advice, especially, I think of our family, and a lot of times what you said, you set up buffet style, and what people don't realize, you're handling the same spoon and whatever dish it is or fork, and that's, that simple measure could help pass the virus along. So that's very important advice that you gave to kind of separate that out by the individual as much as possible. So Gail, anything you'd like to share?
Yes, our Thanksgiving will be small, just my husband and I staying home. We have grandchildren that we'll miss seeing, and the extended family. We now don't have a real big family like yours. I admire that and love seeing the pictures of the holidays with big families all packed into a kitchen preparing food, and that really can't happen this year, unfortunately. But one thing I think we forget about is that people, when we've talked to them and they found they were infected and didn't know it, is they were feeling a little bit sick, or they went anyway. Sometimes I don't, going back, if you don't feel well or something's just off at all, please don't go. I think that's what we kind of recommend to people. And if you're waiting for a test result to come back, act as if you are infected until you know you're not, I think is the best advice there. The other testing piece of information that's helpful to people is to, be sure you wait 72 hours from a time that you think you've been exposed before you test. If I ran into someone who was, told me that they were positive and we'd just been together yesterday, I need to make sure that I let 72 hours pass before I test if I want to get an accurate assessment of my exposure to that person. I think that's right, Vidya, isn't it? I didn't get that. So you don't want to have a false sense of security as well. But I think we're just going to enjoy a beautiful day and be thankful for all we have in our community, and have a little different Thanksgiving and hopefully a little better Christmas, but I'm not so sure of that right now.
Yeah, I think that's an important point that you made, especially with individuals that feel sick or and definitely had tests. You should wait to make sure that you get the all clear sign. But we've had that happen in the workplace, not necessarily the fire department, but other departments where someone might come in or just traveled and came in, and then lo and behold, they end up testing positive. So those are all good proactive measures. If you're not feeling well, doesn't matter where you're at, you should just stay home. How about you, Chief? Anything else you'd like to add?
No, that's exactly what I did, and I think that's what kept it away from my family. Was on that Monday when I had a headache. I had a headache and just felt bad, and I immediately separated myself from my workplace and my wife and kids, and I think that was key to keeping that away from them. I kind of think of it this way: is if you always act like you have it. If you're in a grocery store and you act like you have it, you are going to keep people safe. And there's a good chance you don't. Most people in our community still don't. But if you always act like you have it and you act like everybody around you has it, I know that makes you a little paranoid, but that's okay. This is the time to be a little paranoid. This is not the time to be around people you don't know. It's not the time to hug it out with an old friend from high school. This is the time that you should have a healthy level of distrust for everyone around you. And that doesn't mean you can't have a conversation, as Dr. Sundareshan said, but you can have that conversation through a mask. You can have that conversation from a distance, and you can just take those necessary steps, because those are the times we're in right now. And nobody likes it. It's not fun, but it's just necessary. And if we're going to get through this on the other side, we have to be good neighbors. I've said that from the very beginning, is we just have to be good neighbors, and we have to be respectful of each other, and we have to be respectful of that clerk that's working at the grocery store that doesn't want to walk up to you and tell you to put a mask on, but has a job to do. And that's not fair to him or her to argue with them or to make their day a little worse. They are just trying to keep themselves safe so that they can continue to put food on the table for their family. And if everybody just remembers that, and maybe the holidays will help, everybody will maybe take a little stress off this year without the big dinners and without all of the planning, and just use that to just be nice to each other.
Yeah, that's great advice, especially with the respect, of course, number one, but act like you have the flu or the virus and vice versa, or others do. That way you're sure to keep your distance, and that will help us get through it. And I think the other point I'd like each one of you to comment on to a certain degree, and Dr. Sundareshan had brought it up, is the impact or the post-COVID symptoms. I think a lot of individuals, it impacts the person differently. I've talked to some people who said, oh, I've had it, wasn't that big a deal, but others like yourself, Chief, it's like a ton of bricks hit them. They've never experienced anything like it. And if you can imagine, tragically, some people have difficulty in breathing. I can't even imagine that, that suffocation feeling day in and day out. But we do not know the post-COVID as well, the reoccurrence and things of that nature. So we have to be kind of on a precautionary level with regards to that. But if you'd like to comment on that, Doctor, and then anybody else, as far as just the different symptoms that people can experience, but it's some that we have to be very cautious of because we don't know of another reoccurrence or anything of that nature.
Absolutely. Great question. And so we have seen a myriad of symptoms with COVID. And even the list that CDC has or IDPH has, and locally too, we see a lot of times, okay, this is the time, a lot of people are presenting with headaches as the main symptom. This time of the year where, people are coming in with COVID, we're seeing a lot of them presenting with a lot of fatigue, sometimes just stuffy nose and sinus symptoms. So even for us that are seeing patients present, the presenting symptoms have been different. So it can be anything from upper respiratory symptoms where you have sinus symptoms, headaches, runny nose, cough, just really bad cough, fatigue, some GI symptoms. Some people have presented with abdominal pain and diarrhea as their only symptom. So, based on what these symptoms are, a lot of times, if you talk to your provider, they'll tell you, okay, go get tested. So the presenting symptoms can be different. And how people have COVID, a lot of times somebody is a contact of a case and gets tested and they are positive. So many of them have no symptoms at all. That's a big number there too. But what we worry about is these some people who deteriorate. The danger signs for COVID, when somebody has COVID and is being managed at home, we tell them to watch their pulse ox, and watch their temperatures very closely. So, the Memorial Medical Center and some of the other organizations have a respiratory kit. They'll give a pulse oximeter, and you can track your pulse, how much of oxygenation you have, and then also a spirometer to see whether your pulmonary function is actually deteriorating. So these are things you can do at home. And if someone has chest tightness, really bad shortness of breath, which is worsening, if they pass out, if their lips are getting blue, these are all really bad signs. And that definitely means that they need to be in the hospital, and maybe even in the critical care unit. So if the oxygenation drops significantly, that's one of the reasons when people get admitted. We've seen people have prolonged stay. If they're in the hospital, they end up staying in the hospital for quite some time to recover. The recovery process has been hard for a lot of people. I've seen marathon runners who are just so fatigued. A lot of patients that we see in clinic, there's not much we do in terms of giving them medication for antivirals or anything else that we can do, but it's extensive rehabilitation, pulmonary rehabilitation, cardiac rehabilitation, to make sure that they're able to get their energy back and their fatigue is mitigated by these things that you can add on. We see people with sleep disturbances as post-COVID. They can have insomnia or they can have hypersomnia. So it's a term referred to as COVID-somnia. People have anxiety, a lot of anxiety, depression that we are seeing associated with this as a post-COVID syndrome, or even otherwise, even with this whole pandemic, the anxiety and depression that we are seeing, mental health has taken a huge toll with this pandemic. So that's another thing. Fatigue is the main thing that people struggle with. And clots, people can have an increased chance of developing clots. So heart attacks, strokes, blood clot in the lungs, blood clot in the legs. These are some of the things that people can present with as well. So that this is a lot. This is a big group of symptoms and complications that people can have with COVID and post-COVID.
Yeah, I appreciate all that. A lot of information. And when in doubt, you should just check it out with your primary care physician. Or if you don't have one, of course, public health could step in. And Gail, anything you'd like to add to that?
I think it's been real interesting, and we're hopeful that after all this time that the public is taking this more seriously. We learn something new every time. I'm fascinated by, and I know Alan, I believe, was too, with the opportunities we have to spend time with Dr. Sundareshan and Dr. Graham and Dr. Miller. There's been a lot to learn with them, and they continue to help guide us through this, the situation that we're in. And learning, I think we were excited to hear when Dr. Sundareshan told us that early on, with the first few people that had tested positive and recovered, were able to donate plasma, which was life-giving to some of the people in the hospital. So the people that have recovered are still able to do that for other people in the hospital and needing care. The one thing that Chief Reyne had said and kept track of for us in the beginning was the number of people who really, when we first had our shut down a little bit, were afraid to go to the hospital for heart attacks or other things, or diabetes and things that had gotten out of control. The hospitals are busy, but people really still need to go if they need to go to the hospital for something. Talk to their primary care, but we sure don't want to see extra deaths because people didn't go out of fear of the hospital. The hospitals are busy, but that fear of the COVID at the hospital is not a reason to not go at this point.
Yeah, if you could share with us real quick on the difference between, I've heard isolation or quarantine, or some people say you should quarantine for 14 days versus 10 days. Can you shed some light on that?
I think the difference and I'll let Dr. Sundareshan go over the timing because it's a little complicated by each person on their schedule of when they test positive or first get symptoms. And isolation means go nowhere, stay home, go nowhere. Quarantine is keep yourself away from others is how I would describe it. But Dr. Sundareshan, do you want to do the timing?
Yeah, isolation in simple terms is for somebody that's sick. Quarantine is somebody that has been a contact and you're watching them to make sure that they don't get sick. So anybody that has been a close contact, if they develop symptoms, they get tested. If they turn positive for COVID, then it's typically 10 days. For anybody that's asymptomatic, you want to watch them longer through the incubation period of the virus, which is about 14 days. So anybody that's asymptomatic, it seems counterintuitive, but anybody that's asymptomatic has a longer time for quarantine for 14 days. Anybody that's become symptomatic during the time of quarantine, and if they test positive in that time, it's 10 days. CDC says that anybody with COVID can harbor the virus or pass it on for up to about 10 days. Now there's newer data saying up to 20 days. The recovery period we say is after, for practical purposes, is after 28 days. But infectivity can be up to 20 days, depending on the illness of or the underlying health of the person that gets COVID. The quarantine period can get a little bit more complicated. CDC has a nice calendar to understand that. It can go on longer if somebody turns positive in the household, so their period can be longer based on that. So we've had people getting quarantined for up to a month. And these are calculated based on the household contacts, and the health department does a fantastic job of getting that, and all the other organizations too.
Yeah, I know the Chief struggled with that, the quarantine time period. If you'd like to shed anything else on that, Chief?
No, that's the quarantine time frame for me. It was really about just when I post symptoms, because I was on the shelf for 14 days. But kind of what you were saying, Dr. Sundareshan, I don't know why I pointed, because nobody can see which box you're in except for me. But for me, it was I absolutely do still act like I have it. I haven't ridden in a car with any family members or anything like that. I've been pretty much keeping my doors shut on my office. That's really why I had to not tell the mayor in person that I was retiring, which is not ideal. Certainly a conversation I would normally have face to face. We had to have it over the phone because I am very conscious of the fact that while I've met the requirements, every day we learn something different. And you were talking earlier about different symptoms and things. And the one goofy one that I really had was I didn't completely lose my sense of smell and taste, but really salty and sweet were it. So I lost everything else. So I know my wife was walking out the door the other day and I said, hey, pick me up some strawberry milk. And she looked at me, she said, you don't drink strawberry milk. I said, well, I think I did when I was 7 and it sounds really good right now. So she knew I either had COVID or I was pregnant, one or the other. So, and I also appreciate you recognizing us marathon runners earlier.
Yeah, on the one thing that Chief's done is contact tracing. Director O'Neill, if you could talk about that with regards to that process and the importance of people being honest to who they've been around, so you can help make sure it doesn't spread further.
Absolutely. Absolutely. We need people to communicate with us. It takes a little while, and to trust that we're trying only to reduce the spread in our community, not trying to get anybody in trouble. I think people think if they say who they were with or what they've been doing, they're going to get someone in trouble. And especially if you've made an accident or made a bad choice, and then you think, oh, I shouldn't have been there. I don't really want to tell anybody where I've been. All those feelings go on. The contact tracing program is not judgmental. It's really fact finding and to try to help people, see where they had been and who they may have either got it from or have exposed in the process. In the beginning, we think, and I think it's correct, that we had so many people we were assigning, cell phones, the disposable phones, so people didn't have to use their own phone numbers, and people were getting calls from numbers they didn't recognize. I would see that as something I wouldn't like, answering phones. So the people we didn't know and numbers coming in. The newer system using the computers and Salesforce sends a call that says this is from public health. So there is some validity to that. I think things we've learned along the way help make contact tracing better. But at the same time, there's people that just don't want to share because they don't want to get someone in trouble. But that's the only way we're going to know where the hot spots and the risks in our community have been. Looking at the number of responses we had gotten based on the thousands of people who've been positive, you'll see that there's, not, a quarter of the people probably have told us something that would help identify where the virus had been or where they might have been. So we're hoping people now realize it's going to be helpful, and when the contact tracer calls, that they share information. And as you mentioned, Mayor, we're behind a day or two from finding out that a positive person's positive. So they have, if you're positive, it's time to start thinking about who you may have exposed, where you may have been, and start those calls and keep a list of them with phone numbers for us and for the contact tracers to make it a little bit easier. The other things that's a challenge is when you fill out your form saying you want to test, we all fill out forms so rapidly and so quickly. There is quite a bit of misinformation or, guesses on what the address or phone number that's on there on the forms have nothing to do, and there's data entry issues. So there are sometimes people that said they hadn't been called, and we may find out that we didn't even have a valid phone number. That's not the majority, but it's all these little steps that can make our job easier in finding people and trying to reduce the spread to others. It's not like we're trying to get in anybody's business except for to try to track the virus.
Right. Well, thanks for that recap. That's very helpful. So if you'd like to make some closing comments, and then we'll wrap it up. We'll start with Dr. Sundareshan.
Yeah,
Thanks for being here.
Thank you again, Mayor. Thank you so much for the opportunity. And this is a difficult time for all of us. We have these public health guidelines that really, really work. So be very, very mindful of those, follow those as much as possible. Our immediate thing is to keep ourselves safe during the holidays. So follow whatever you can to keep yourself safe and your family safe, and have a happy Thanksgiving.
Well, thank you. We appreciate all you've done for our community, and thanks for being part of this educational component. Chief? He's still trying to figure out how to unmute. You have to unmute. There you go.
Caught me. That's the first time I've done that. So, I was going to start off by just telling everybody to, have a great Thanksgiving and do what you can to spend time with your family. Make it virtual, make it distant, and just do what you can, because this is a terrible time. Nobody is enjoying this. This isn't healthy for our community. Just being apart, we all need that personal contact, and whether you come from a big family or a small family. And it's just the time to listen to these people, because they know what they're talking about, and they have provided this community with a wealth of knowledge. Not trying to panic people, but trying to inform people. And that's been our message from day one with the fire department is, we're not out here to get people stirred up and in a panic. We just want you to have good information. But part of that is your responsibility to take that information, to heed that advice, because it's not coming from me. It's filtering down through me from people that know a heck of a lot about how a virus spreads in our community. So we will get through this. I look forward to seeing the Facebook Lives of 2021. And when we're talking about other things like potholes and snow removal, and I look forward to those days when we can get back to the normal business of running the city that the mayor has such an important job to do in the county with Gail and Dr. Sundareshan. So thanks for having me.
Thanks, Chief. Director O'Neill, thanks for being here. We appreciate it.
Thank you for the invitation. I appreciate it as well. And again, we really want everybody to take responsibility for this. It's not any one group. It's going to take all of us in this community working together for the health of the community. We know everybody's suffering in some way with the effects of this, whether it's missing work or, not having work right now, all those kind of issues, having kids home from school. There's a lot of challenges that every family's faced with. And we need to be thankful for the good days. The other little thought I was thinking about is the people in the nursing homes. If you've got a few minutes you're not spending on cooking like you had in the past, maybe you could do a phone call to someone who's really lonely and been pretty much locked up. So that for their own good, yeah, but for the situations of your friends and neighbors and people you might just give a little joy to with a phone call, I think that would make it a nice holiday season.
Yeah, without a doubt, that was an important point, is just a simple phone call and hearing from someone, you really brighten up their day. I go back to my granddaughter. That's one of the things that, I think I have a lot of hard decisions to make, struggles when you go back home and see a smiling face like that or hear from someone that really does lift individual spirits. And so, I appreciate, I hope you all have a happy Thanksgiving, especially our viewers and everyone we serve. We can't thank our healthcare providers enough. Again, real quick, because some people think, oh, we've been through this, it wasn't as severe. This graph tells it all. I say we're in the first wave because look at the spike. And so we were great at mitigation right here, and we can do it again by wearing our mask and taking appropriate precautionary measures to make sure that the hospitals get the relief they need, our healthcare workers that can provide the services that we all want, but most importantly, keep one another safe. And right after Thanksgiving, of course, is important to our small retailers. So I'd encourage everybody to visit their restaurants and take the to-go orders and support them as much as possible, the local restaurants, because they need the support. Again, a reminder to them, they can go to springfield.il.us/grants. We do have the $5,000 grants available. We're looking at a utility mitigation for the small businesses as well that the council will take action on next couple of weeks. But for our small retailers, today kicks off the holiday walk for downtown Springfield. And so if you can visit those small retailers, all of them, even the big box, are 25% capacity. So we'll be watching that from an enforcement aspect. But when you go out, it's real simple. Just make sure you mask up and, support the retailers and small businesses that help build our community and keep us strong. And we want to make sure that we can help them through these next few months. And before we know it, it'll be springtime. So with Thanksgiving coming up, it's important that we share with loved ones, keeping health in mind first and foremost. So have those limited gatherings. And then that way we can spend many holidays together. That's the most important thing. So next week, we won't have the Facebook Live will redo after Thanksgiving. But in the meantime, be sure to treat every person with respect. We have this same goal in mind. How do we get through these, this virus together? We've been doing a great job. Our greatest strength is our people within our community. They make us strong, and we do that together. And so we all want to keep in mind that let's make today better than yesterday and tomorrow better than today. So I hope you all have a happy Thanksgiving, and we will see you the Wednesday after Thanksgiving. Thanks for being here.